So I'm with Professor Peter Hutchinson, who's running the rescue trials. Could you just explain a little bit what these trials have been aiming to do?
So these trials are surgical trials in head injury, and they aim to determine whether one of the treatments that's applied in head injury is effective. This is quite a simple concept in terms of removing a large piece of the bone to try and help with brain swelling, an operation called a decompressive craniectomy. And the trials are randomized, so patients are allocated to either have this operation or other treatment, medical treatment for their head injury, and then we look at the end of the study to see which leads to the best outcome.
That's great. And are you able to give us an idea of what the results are, or when the results are coming out?
So there's actually two studies that are taking place. There's one called Rescue ICP. This is a study to see whether bone removal helps the patients who've got a brain swelling, what we call a diffuse brain injury, and that study's finished collecting patients, and the results will be coming out towards the end of 2015, the beginning of 2016. The second study is called the Rescue Acute Subdural Study, and that's slightly different, and that aims to determine whether we should leave the bone out after an operation when we've removed a blood clot called an acute subdural hematoma, and that study has just started, recruited 50 patients, and has a target to recruit 120 patients by next March before a bigger study up to 900 patients starts at that point.
Well, we'll definitely look forward to the results of that. And what do you see in the future for surgical trials for brain injury?
So in terms of the future, I think we need to improve the methodology of these trials. We need to look consciously at the inclusion criteria, which patients we're putting into the studies. We need to look at better markers of outcome. At the moment, our outcome measures are quite crude, so we need to try and determine better measures such as quality of life, neuropsychological outcome measures, and also make sure that we power studies appropriately so we have enough patients in order to answer the question.
Fantastic. Thanks very much.